Hey everyone, Dr. B here at Vitruvian, Chiro, and Rehab in Cupertino, California. And today we're going to be going over home care for TMJ disorders. So this is care after you've seen your chiropractor, acupuncturist, TMJ specialist, or medical doctor. And so these are some tips for what do I do at home to take care of my problem so I don't have to come to the office as much and I can get better faster. And so first, let's go over a little bit of anatomy. And so what is the TMJ exactly? It is the temporomandibular joint where your jaw, mandible, inserts into your cheekbone. Right there is a joint and there's a disc and there's a bunch of tissue and muscles that surround it. And often people with TMJ issues complain of pain, stiffness, tightness in the jaw, clicking, kind of a crunchy sound when opening, and sometimes they have a limited range of motion or it gets stuck at a certain point when you're opening your mouth. For me, it's I've had pain on the left side, and there's a really crunchy sound and a little bit of a click when I open my mouth all the way. And so my home care routine is as follows. So first I start with a little bit of palpation. So I like to feel around with my hands, like where are the tight spots, where is it tight, tender, a little sore. So for me on the left side, it's right in here, right? This is my masseter muscle. So it's a big muscle that helps open and close the jaw. I have problems here and in the front of it. So if you poke in, there's like the anterior portion and the temporalis, which is a big C-shaped muscle. And this starts here, inserts on the inside of your jaw and helps close your mouth. Does that motion. So there's always little tender spots in here. Mine's right in here. And then I like to work on the digastrics, which run along the bottom here. And there's two other muscles, your medial and lateral pterygoids, which sit underneath the masseter. And to get to those, you have to go inside the mouth. It's pretty uncomfortable, but very effective. And that is the treatment that you get in office, along with additional muscle work and cervical adjusting. All help relieve some of that jaw pain. So first, you take your 3 fingers, and I like to run it along the side of my cheek. And while I'm doing that, I slowly open my mouth. So watch. So I do about 3 to 4 passes. If your skin is feeling dry, you can use a little bit of lotion. If you have massage oil, some kind of cream. Generally when I'm doing massage work, I like to stay away from scented stuff, and I like to use Eucerin, or you can use whatever it is that you have at home. You don't have to go out and buy new stuff. Don't need to spend more money. So 3 to 4 passes here, and again, that tender spot in the temporalis muscle, I'm going to take my glasses off for this. Again, as you open your jaw, slowly open, another 3 to 4 passes. And to work on the digastrics, I take my thumb, my rock tape thumb, and as I open slowly, work along that muscle belly. So 3 to 4 passes. And then we're going to go into trigger point therapy. I forgot a portion. To work the anterior part of the masseter, slowly open your jaw and work those muscles. 3 to 4 passes. And for trigger point therapy, we're going to find those tender spots. We're going to push in, okay, medium pressure. You're going to find those little tender spots, and you're going to massage clockwise. You can go counterclockwise. You can switch it up. I tend to do clockwise, it's just a habit. 7 to 8 seconds. You come off of it for about 2 seconds. You go back in. 7, 8 seconds. Do that 3, 4 times. So I work on the masseter here. This front part, you can go into the temporalis as well. Same thing, 3, 4 times, 7, 8 seconds. Come off of it. back on, so on and so forth. So just some tips: do that 2 to 3 times a day, no more than that. If you're feeling a little sore after, just take a little piece of ice, do a little ice massage, a few minutes. You can either put it in a plastic bag, you can put it in a paper towel, just to help manage some of the soreness and the pain in your TMJ. If you have any questions, email me below or leave a comment and I can get back to you. Be healthy, be happy. Thanks for tuning in.